Every patient is slightly different. We have to get used to the differences in anatomy, and this whole idea of a world where robots just operate on patients without being trustworthy is science fiction. Robotics is certainly on the rise, but we have a long way to go. In some instances, they already have taken over the operating theatre, but I want to hastily get rid of a myth. The myth is that robotic surgeons like me sit in the operating room, the machine is programmed, press a button, drink coffee, and the machine does various things. Nothing could be further from the truth. The robot is an interface between the patient and the surgeon, where the surgeon is able to perform finer keyhole surgery for the patient rather than making a big cut. So less blood loss, less pain, quicker recovery, and shorter hospital stay. Good for patients, good for society. For operations such as prostate cancer, when I started 20 years ago, I was one of very few surgeons performing this kind of surgery. So probably 1% of such operations in the UK were done robotic. Fast forward 20 years, where we have done 10,000 robotic procedures, multidisciplinary, not just for prostate cancer, but for a whole load of other indications. Now, 94% of these operations in the United Kingdom are done robotically. With the advent of AI, there's a lot of talk about programming these machines so that they can autonomously do surgery. Again, my view is that while today certain steps of an operation could perhaps be done in an autonomous fashion, this is not like driving fast cars that drive themselves. Every patient is slightly different. We have to get used to the differences in anatomy, and this whole idea of a world where robots just operate on patients without being trustworthy is science fiction. Robotics is certainly on the rise, but we have a long way to go.